Thank you, Caoirleach, and Minister, you're very welcome into the chamber again. The only question that occurs to me is, are we really going to do this now? As we face into our second winter with COVID, when we've just kicked the reopening ball down the road again, we're revisiting a 10-year-old promise from Fine Gael and Labour to solve the problems in the public health sector by eliminating the private. In November 2015, we were told that Sláintecare was put on hold due to the State Departments of Health finding that of universal health insurance would lead to approximately 11% higher expenditure than the existing system. 2 years later, a committee gave us the slogan, "A universal healthcare system will provide population, promotive, preventative, primary, curative, rehabilitative and palliative health and social care service to the entire population of Ireland, ensuring timely access to quality, effective, integrated services on the basis of clinical need." A lovely sounding mission statement, to be sure, but unless we can sell it for $3 billion, it brings us no closer to delivering universal healthcare. And now, 4 years on from that, we're still talking about it because the head honchos finally realise that the requirements for implementing this programme are seriously lacking. It's doomed to fail and it simply will not happen. We don't need Sláintecare to get moving on the real, current, pressing issues with our healthcare system. We have some regions experiencing 1 in 5 permanent consultant posts being left unfilled, and yet the HSE is cutting 350 junior doctor jobs that were given last year in order to fight the pandemic. Nursing staffing levels dropped by more than 3,000 from 2007 to 2017, and yet the Nursing and Midwifery Board of Ireland accepts less than 10% of work applications from the US nurses. Policies and structures currently in place are exacerbating these problems, not alleviating them, and Minister and the departments don't need Sláintecare to fix them. And yet, this pie-in-the-sky promise is what we are discussing, rather than simple, practical solutions. But what a time to resurrect them, when we've just been told that Friday's D-Day has gone up in smoke, and the governments again foist the blame and the burden of the people of this country, rather than recognising its failure to prepare, adapt and react. On the 16th of July, you told us, this House, that the second best scenario presented by NPHET now shows over 200 people in ICU in just a few months' time. Currently, there are 74 cases in ICU, and we're not even being told how many of those COVID patients are in ICU due to COVID, or are in ICU for other reasons but have tested positive for COVID. The narrative is ICU and hospitals is going to be overrun, and if we don't continue certain COVID measures, it's not exactly a new tune, is it? It's been 16 months since 2 weeks to flatten the curve. It seems like a lifetime ago, so I won't blame people for not remembering. The deal was that people of this country would put their lives on hold for a few weeks, and that in return the government would put in place the necessary healthcare infrastructure and bolster capacity necessary to accommodate those falling ill due to the virus. It never happened. Precious little was actually done. Instead, lockdowns and mandates were used as a blunt instrument to suppress case numbers. And once again, the ordinary people of Ireland were made responsible for the government's remit. It's not like it couldn't have been done. Sweden doubled its ICU capacity in order to tackle the pandemic, with the numbers of ICU beds in its capital quadrupling. They ordered new equipment, scrambled to retrieve old ventilators from the basement and emergency reserves. They used anaesthetic machines and borrowed ventilators from private caregivers. They scrapped all non-essential administrative work for staff so that they would have more time to look after patients. They drafted in volunteers, staff from other regions that were less affected by the outbreak, and staff from private caregivers in Stockholm. In short, they reacted accordingly and they did their job. And how many ICU beds did we get in the last winter plan? 17. And let's be clear, this isn't a COVID issue. For those who can remember back before the pandemic, the trolley crisis loomed large for quite some time. Nearly 100,000 on trolleys in 2017. 2018, worst year for hospital overcrowding, according to the INMO, and 2019 the same, long before COVID existed. Any pressure on the healthcare system isn't due to a minority of people who have opted not to receive a vaccine. It's due to poor policy, stagnated decision making and a health service executive mired in bureaucracy. And nothing exemplifies that more than these. lateral flow tests kits, more commonly known as antigen tests, first mentioned in this House by me in July 2020 and obstinately ignored by our NPHET overlords who refused to sanction antigen testing for staff, visitors and residents in hospital and nursing homes, even though it might have identified some of the outbreaks earlier. And now, finally, after 15 months of their use first being mooted in the Seanad by me, the Government says we'll look into using them 7 months after the UK are free to whatever. Minister, I think antigen tests need to be used. In the UK, these are handed out in pharmacies, free to every single citizen. Today, you're only making these available to people that are vaccinated. People that are vaccinated. So if you're vaccinated, if you're not vaccinated, you can't even avail of this. Ridiculous. Thank you.